Hi there, I'm Matt,
I'm Becca.
and we will be taking you through some orthopedic measuring techniques today, especially for children, tibial torsion and the likes. So here we go. For this first test, it's going to be the thigh-foot angle for tibial torsion. You will use this test only if there's no foot abnormalities. You have your patient sit in prone or lie in prone position. You flex the knee that you're testing to 90 degrees. And then we've already made pre lines here, so I'll show you. Bisecting the middle of the thigh here, and then bisecting the middle of the foot from the calcaneus to the space between the second and third metatarsal heads. And so the angle that I'm going to be taking is going to be, I'm going to grab my goni here, is going to be this angle from up top. You put the fulcrum on the calcaneus, and then line up the stationary arm with the one of the thigh, and then the movement arm on the one on the foot. And one other thing that you would like to do with this, or that you should do, is when you make this measurement, you push down on the lateral aspect of the toes just to make sure that the patient is in neutral dorsiflexion. Normal value for this should be about 10 degrees. So that is the thigh-foot angle measurement. Next, we'll do the hip external rotation and internal rotation. For this one, I will be using a pathfinder just because it's easier to place on the tibia rather than using a goniometer with one hand. For external rotation, we're going to go ahead and apply a firm pressure on the PSIS of your patient. Just so that you can, when you move them into external rotation of the hip doesn't pop up on you. So I'm going to go ahead and move her into as far as I can before I start feeling movement at the hip here, but make sure that it's stabilized. Go ahead and place the pathfinder or your goni or ankle monitor on the shaft of the tibia. Here she is at 45 degrees of external rotation. And then go ahead and do internal. Same thing on the other side. And over here she's at 42. So that would be normal because with internal external rotation, it should be about the same both ways for a child and for an adult. Next, we have the Ryder's test for femoral torsion, or this is also called Craig's test. And for this one, as you can see, we've already bisected the lateral aspect of her thigh. You're going to need that line for the measurement. But what you have your patient do, you have them in prone here, and then you bisect the middle of their thigh all the way up to the location of the greater trochanter, which I have right here. Then you place your fingers, your index finger and your third finger, like you bisect in between your two fingers with the line right above the greater trochanter. Then you go ahead and externally, internally rotate the hip until you feel like the greater trochanter of the femur is right in between those two fingers. So I'm going to have you hold your position right here for me. Okay. You could also have, if you had another hand, this would be a lot easier to do. Another person, hold your position right there for me, and then you throw the goni right there on your patient's tibia. And with her, she has 10 degrees, which is normal for Ryder's test. So next, we will move on to the popliteal angle, where Becca will take over.
Okay, so for the next one, we are doing popliteal angle like Matt said. So I will have him, he can be supine, and I'm going to bring his hip to 90. And then we're going to bring his leg all the way up here. Good. I'm just going to come up this side. And then we place the goni on the outside part of his tibia. And he's at about 90 there. Good. Okay. And then the next one that I'll do is the Transmalleolar Axis. And so for this one, I will have you long sit.
You don't need I'll just hold
Oh, yeah, thanks. Perfect. And so for this one, I'm going to make sure that I can have my patient get into a neutral 0 degrees of dorsiflexion like he is there. And then with our calipers, we're going to bisect those malleoli on the sides. But since they're at different levels, we have to make sure that we get that measurement right. Good. And then I have him pre-marked earlier too. So we would take that measurement. And then for that, he is at 7 centimeters. So we'd mark that as one of our measurements. And then we measure the distance from the malleoli side here down flush with the table. So I'll do that right here. And for him, he would be at about 6.5 on the medial. And then 6 on the lateral. And then you use those measurements to come up with that equation. And then lastly, we will do our scoliosis screening. So I am going to have Matt take off his shirt as he did for me. Thank you. And then I'm going to have you bend down and touch your toes as far as you can. Good. And then we're just looking for the apex here. So for him, that'd be up here. Otherwise, we're looking to see if there's any other abnormal curves there. So I place that angle finder there on his apex, and he is at 0. So you go ahead and stand up. So he would be good for no scoliosis.
Thanks for watching.
Yes, thank you.